In this video, we will be discussing the second part of the orthopedic images. The first image shown is of Mirrell score. Mirrell score is basically calculated for pathological fracture. So, in Mirrell score, what we see is localization, pain, type, and size. In the localization, if it is in the upper extremity, 1 point is given. If it is in the lower extremity, 2 points. And in the pertrochanteric region, 3 points. Then pain, if it is low, 1 point, medium, 2 point, and big pain is 3 points. Type is osteoblastic, 1, mixed, 2, osteolytic, 3. And size less than 1/3, 1/3 to 2/3, and more than 2/3 width of the bone. So these 4 points we see where the fracture is located, what is the amount of pain, what is the type of lesion, and what is the size. So if the total point is less than 7, then the risk is 4% and preventive open reduction internal fixation is no. Means we don't need to do open reduction internal fixation. And if it is 8 points, then the risk is 15%. And it is indication on border. And more than 9 points, risk is 33% and indicative for preventive open reduction internal fixation. So we need to remember what accounts for 1 point, what accounts for 2 points, and what accounts for 3 points. And the total score, if it is 7, 8, 9, 4%, 15%, 33%. No open reduction, on border, and indication for preventive open reduction. So that is about Mirrell score. It is for pathological fracture. Then next is the order of tissue repair in replantation. In the replantation, like somebody's finger or any limb is damaged, then how we will repair it. So the mnemonic for this is B fan of VS. VS Virendra Sehwag. Okay. So first we will be doing the bone, then we will be extensor tendon, and then flexor tendon, then is artery, then is nerve, then is vein and skin. B fan of VS, bone, extensor, flexor, artery, nerve, vein, and skin. The next is Gustillo-Anderson classification. Gustillo-Anderson classification is for the open fractures. So the first one is type 1. Type 1 means with a wound less than 1 centimeter and long and clean. And then type 2 is more than 1 centimeter but without any soft tissue damage, flaps or avulsion. So difference between the type 1 and type 2 is basically of the length of the wound. Then is type 3. Type 3 is further divided into 3 types. Okay, type 3A is adequate soft tissue coverage is present. And in the type 3B, periosteal stripping and bone exposure occurs. Okay, and in the type 3C, is associated arterial injury. So in the type 3, soft tissue will be massively damaged. But if adequate coverage is present, then it is 3A. And if there is periosteal stripping, then it is 3B. And if there is arterial damage, that is blood vessel is also damaged, then it is type 3C. It is very important in the open fractures and it is most frequently asked. The next image we have is of Clipple syndrome. Clipple syndrome has springel anomaly. Springel anomaly, in this basically the scapula is elevated, the cervical vertebrae is fused and there is decreased neck mobility. See here the scapula is elevated. This is normal scapula, this is elevated and the cervical vertebrae are fused. That's why the neck is short and there is decreased neck mobility. So in these cases, basically there is means parents are asked that the child should not be involved in any injurious sports that would cause the harm to the neck in the due course of the sport. So that is about Clipple field syndrome. Then this is image of Marfan syndrome. Marfan syndrome has long thin fingers and hypermobile joints. Okay, the person hyperflexibility is there. It is Marfan syndrome. What other thing is related to Marfan syndrome? We studied in ophthalmology. It is the ectopia lentis. The lens is dislocated upward, fans out. Okay, and the other was it is related to chromosome number 15. This is image of plantar fibromatosis. See here, fibromas are there in the plantar region. It is plantar fibromatosis. Then this is the image of Hallux valgus. Hallux valgus, or also known as bunion. Here the thumb is towards the side of the fingers. Thumb is bent toward the side of the fingers and the first metacarpal, this region is more prominent. This is neurofibromatosis, caffeolate spot. Caffeolate, coffee colored spots seen classically in the neurofibromatosis. This is image of bamboo spine. Bamboo spine is linked with the ankylosing spondylitis. Bamboo spine ankylosing spondylitis. Another image. See, it is appearing like bamboo spine. Okay. Then this is image of made-lung deformity. Made-lung deformity, the appearance is typical, like hair will be bulged. Then bone bridge formed prematurely across the faces of ulnar side of the distal radius. On the distal radius, ulnar side, there will be bone bridging, okay? And the ulnar head was overlapped with lunatum triquetrum. In the lateral view, dorsal subluxation of the ulnar head and palmar shift of the carpal bones. Okay, but it will be occurring. Palmar bones will be carpal bones. Carpal bones will be palmar shift and the ulna will be dorsally subluxated. Ulna here is dorsally subluxated. Then this is image of Hagland deformity. This was made lung. Made lung is in the hand and Hagland. Hagland is in the calcaneum. Okay. H is not in the hand, it is in the calcaneum, in the posterior calcaneum. This is another image of Hagland deformity. It is related to tendo Achilles. Okay. In the region of the tendo Achilles, there will be inflammation. Then this is anterolateral bowing. Anterolateral bowing of the tibia occurs in congenital pseudoarthrosis of the tibia. This is X-ray image, congenital pseudoarthrosis of the tibia. This is osteogenesis imperfecta. In osteogenesis imperfecta, multiple deformities will be there. Okay. Then this is image of knee joint and it is showing the tendons and the cartilages here, ligaments. See, here is adductor tubercle. This is medial condyle of the femur and this is the tibia. So here will be medial meniscus and medial collateral ligament. Medial collateral is connecting the femur and the tibia and the medial meniscus between the condyles. Then we have the medial cruciate ligament and the anterior cruciate ligament. Medial cruciate ligament, then anterior cruciate ligament. Then is posterior meniscofemoral. It is not that important. Lateral condyle of the femur. Then is lateral collateral ligament. The tendon of popliteus muscle. So here the medial meniscus and the medial collateral ligament, they were directly attached to each other. But here the lateral collateral and the lateral meniscus, they have in between tendon of the popliteus muscle. This is the head of the fibula. So what it important here is tendon of the popliteus separates the lateral meniscus and the lateral collateral. Okay. Then this is image of unhappy triad of O'Donnell. unhappy triaphodongu is what it is. It is the injury to the anterior cruciate, to the medial ligament, that is medial collateral ligament and medial meniscus. So the injury to these three ligaments collectively is known as unhappy triad. This is another image. It is also showing the similar thing. The ACL is torn and the medial collateral and the medial meniscus is torn. Then next we have done the unhappy triad. Then is femistal triad. Femistal triad is linked with the tuberculous arthritis. It is progressive joint space narrowing, juxta-articular osteoporosis, and peripheral erosive defects of the articular surfaces. So what will occur? In the region of joint, the joint space will be narrowed and the osteoporosis will occur. The bone will become weak and the peripheral erosive defects will occur. Okay. That is Femistus triad. Femistus P occurs in TB. Okay. Then is Bergmanstride. Bergmanstride is associated with the fat emboli syndrome. In the fat emboli, the mental status changes occurs. The petechiae are found often in excellent thorax and the dyspnea. Okay. Mental status changes, petechiae and dyspnea in the Bergmanstride. Then is patellar clung syndrome. Patellar clung syndrome, what we need to remember, it is related with the superior pole of the patella. Okay. Then it is showing fracture patella. Here is femur, here is tibia, and here is patella. Here the one segment of the patella gone upward and the other fracture segment is here. This is another image and the tension band wiring. Tension band wiring has been done in the fracture patella. The tension band wiring converts the shearing force into the compressive forces. Okay, and the wires used here is K wire. Then next, this is this figure showing the stress fracture. See, here are the metacarpals and metatarsals, and these are the tarsal bones, these are the metatarsal bones. Then we have phalanges. In the second metatarsal, in the region of the neck of the second metatarsal, it is the most common site of stress fracture. Then we have the sequence in which the stress fracture occur. Most common is in the metatarsal. Sorry, I have written carpal here. It is in the metatarsal, then in the fibula, and then in the tibia. How we can remember it? In the most weak bone, like metatarsals are weak, then more strong is fibula, and tibia is more thick. So in the tibia. Then this is the sigons fracture. Sigons fracture is due to ACL injury and it is lateral capsular avulsion. In the hair, in the region of the lateral capsule. This is medial and the lateral side of fibula. In the region of the lateral capsule, the avulsion occurs. This is known as sigons fracture. It is ACL injury, anterior cruciate ligament injury. This is malignus fracture. In the malignus fracture, the both sided same side fracture occurs in the ischium bone and here. Okay. This is malignus fracture. It is in the region of the pelvis. Observe the unilateral superior pubic and inferior pubic ramus fracture. This is Wilson's fracture. Wilson's fracture is fracture of the middle phalanx. Middle phalanx is fractured. This is proximal phalanx. This is middle phalanx. Okay. So middle phalanx and proximal phalanx. The middle phalanx is fractured here. This is Wilson's fracture. Then next we have the TAR syndrome. TAR syndrome stands for thrombocytopenia and absent radius syndrome. It is an autosomal recessive disorder. How we'll remember? It is from the name itself. TAR syndrome, T for thrombocytopenia, AR for absent radius, and AR is also autosomal recessive. Leukocytosis will occur. Bilateral total aplasia of the radius. The radius will be absent on the both the sides. The thumbs are also generally of normal size and shape, but are often held in flexion and can result in implication. Okay, thumbs will be held in flexion, and congenital thrombocytopenia can occur. Thrombocytopenia is there, but leukocytes, white blood cells are elevated. This is halt or arm syndrome. Halt or arm syndrome is also known as heart hand syndrome. In the halt or arm syndrome, it is an autosomal dominant. TAR was autosomal recessive, but it is autosomal dominant, and abnormalities to the bones of hand and arm and cardiac abnormalities will be there. Mutation in the TBX5 gene. Okay, what can occur in this congenital heart disease? Atrial septal defect, ventricular septal defect, conduction defects, leading to bradycardia or fibrillation. Then radial deficiency. Radius may be absent. Then in the region of carpal bones, synostosis, hypoplasias, additional bones, in the little finger, clinodactyly, radial deviation. Brachymesophalangia, okay, means mesophalange. Middle phalanx is short. In thumb, aplasia, hypoplasia, triphalangeal thumb. Hand heart syndrome, basically it is. Then next we have the Poland anomaly. In the Poland anomaly, basically there is absent pectoralis major. Here the pectoralis major is normal on this side, but here the pectoralis major is absent. And brachysyndactyly means fingers are short and fused. The fingers are fused here and they are short. This is brachysyndactyly. Then next we have the image of infantile osteopetrosis. Infantile osteopetrosis means increased bone thickness and density, also known as marble bone disease. Here, see here the black, somewhat black is there, but here it is fully white. The bone thickness and density has been increased. This is also known as marble bone disease. Then next is osteopoicelosis. Osteopoicelosis is islands of sclerosis. Here, not full thickening in not in all the regions, but in the there are islands of means in some areas only sclerosis has occurred, increased density has occurred. And this is image of coxavera. Coxavera neck shaft angle less than 120. Okay, the angle between the neck and the shaft of the femur, if it is less than 120, then it is known as coxavera. So that were all the images we need to discuss in the second part. I hope it will be helpful to you. If you find my content useful, please do like and subscribe my channel. Thank you.